right, so hi and welcome to the Our Lady Star of the Sea Healthcare Ministries series about thriving in the times of COVID-19. My name's Megan Weigel. I'm a nurse practitioner at First Coast Integrative Medicine, and this is Melissa Hartman. Melissa, do you want to introduce yourself?
Hello, I'm an exercise physiologist and personal trainer, and I teach at Kaiser University in the Health and Human Performance program here in Jacksonville.
Thanks, Melissa. So we are coming to you to provide you with resources to increase resilience and decrease anxiety during the COVID-19 pandemic. And we wanted to use a virtual platform of presentation so that we could reach more people in our community and so that this can be easily accessed. So you can access this over and over again. If you so choose, you can distribute the information to people that you care about if you find it valuable. And we're doing this series in two parts. The first part will be tonight, and this is myself and Melissa talking about nutrition and exercise. And the second part will be presented according to what we believe are excellent ways to help you with mental health during the pandemic, and also how to use prayer to decrease anxiety. So without further ado, we'll get going here. I'm going to give you a little overview about COVID-19 to begin. These statistics are accurate as of literally today, so I can't guarantee what things will look like in 3 weeks from now, but the coronavirus is a novel coronavirus, SARS-CoV-2. What we know of as COVID-19 is that novel coronavirus. There are over 7 million diagnosed cases in the US and over 200,000 deaths in the US. And many people say, well, this can't be anything serious because there are way more cases of the flu. And there certainly are way more cases of the flu every year, but also there are, in the past 4 years, anywhere between 30 and 70,000 deaths of the flu versus the 200,000 that we see related to COVID-19. In Florida, we have over 700,000 cases and just over 14,000 deaths as of this morning. And the new cases per day since September 1st range anywhere from just over 1,600 to almost 3,700. The risk for severe illness increases with age, but I want to talk to you specifically about other risk factors, symptoms, what you can do to protect yourself and others, and then just a brief little snippet about vaccines in development. So first, let's talk about symptoms. The symptoms of the coronavirus, well, the list of the symptoms keeps getting longer and longer. But what we have identified for sure is that loss of sense or taste or smell is almost diagnostic of COVID-19. The range of symptoms goes from fever, chills, cough, shortness of breath, to body aches, to diarrhea, to nausea and vomiting, to simple mild symptoms. And it's important to understand when you should seek medical attention for these. And these symptoms, when they become emergent, are when you have trouble breathing, persistent chest pain, any new confusion, difficulty staying awake, or signs that your body is deprived of oxygen. Additionally, people want to know, am I at greater risk for COVID-19? Well, what we do know is as you age, you're at greater risk for more severe disease. And so that just means me in my 40s is at a greater risk than someone in their 30s, and my husband in his 50s is at a greater risk than me for developing severe disease. But so are people with other medical conditions. And now that we have enough data under our belts, we do know that people of any age with the following conditions are at increased risk of severe illness: cancer, chronic kidney disease, chronic obstructive pulmonary disease, an immunocompromised state from a solid organ transplant, obesity, which is a body mass index of 30 or higher, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, which means an enlargement of the heart or overworking of the heart muscle, sickle cell disease, and type 2 diabetes. There might be increased risk for severe illness if you have these conditions listed here. And the website I'm taking you to, as you might be able to see, is the CDC website. So you can come back to this anytime for information. So what can you do to protect yourself? Well, the biggest thing that you can do is to avoid being exposed to the virus. And how do we do this? It's pretty simple. We wash our hands a lot. In fact, it will be interesting to see what kind of flu season we have because everyone is doing such a good job at washing their hands. If you have to cough or sneeze, you do that into your elbow. You use a hand sanitizer that has at least 60% alcohol if soap and water are not readily available, and you try to avoid touching your eyes, nose, and mouth with unwashed hands. You avoid close contact inside your home with people who are sick or who are sharing space with people who are sick. For example, healthcare providers who come home, many people have a doffing room where they take off their clothes from the hospital or from the office, and then they change before they come in the house. And then outside your home, you can still maintain that 6-foot safe social distancing distance. Remember that some people without symptoms may spread the virus, and keeping distance from others is especially important for people who are at higher risk for getting sick. Cover your nose and mouth with a mask when around others. Even if you don't feel sick, you can still spread COVID-19. And even though masks aren't perfect, we do have data that speaks to the airborne spread, the droplet spread, and we know that masks offer some protection. We, again, cover our coughs and sneezes, clean and disinfect frequently touched surfaces, and monitor our health daily. Now, in the state of Florida, the mask mandate was just a couple of days ago removed. However, I believe that this is still up to businesses. It's certainly still up to you as a person with rights, whether or not you choose to wear a mask. However, in my practice, we still wear masks, and we recommend that others do as well because we're caring for vulnerable populations, and I care about the people that I take care of. So the way that I think about masking is that it's really for the greater good. And then finally, vaccines in development. The website I'm taking you here to is the New York Times. And actually they have this great interactive regularly updated site. You can Google New York Times vaccine tracker. And what you can see here is that there have been no vaccines approved. There are 5 approved for limited use. There are 11 in large-scale efficacy tests. There are 14 in expanded safety trials, and there are 27 that are currently testing safety and dosage. There are multiple mechanisms for vaccines that are being used for the coronavirus. I'm not going to go into that because, frankly, we'd be here until tomorrow. Or if not, into the next day. But know that what we're looking for is efficacy proven in phase 3 clinical trials, which include thousands of volunteers and are studied versus placebo. In June, the FDA said that a coronavirus vaccine would have to protect at least 50% of vaccinated people to be considered effective. One thing to keep in mind is that the vaccine data hasn't been around long enough for us to know how long the vaccine offers protection. So we know that most of these vaccines are causing an antibody response, but what we don't know is how long that antibody response lasts. So let's move on to support for your body. I'm going to talk to you about nourishment, specifically about nutrition. And part of nutrition to me and nourishment to me includes getting outside and getting in nature. And I know personally that many people were scared to even go outside in the beginning of the pandemic. But now that we can feel a little bit of fall in the air, if that's what we call it here, I really encourage you, if you don't have a reason not to get outside and get some sunshine daily, get some natural vitamin D, just do it on your patio or in your own yard. Also, assuming the people in your house are asymptomatic and have no known exposure to COVID-19, hug the people in your house a lot and hug them for at least 30 seconds. It causes the release of all sorts of lovely hormones in the body that decrease stress and enhance relaxation. Feed your body good food, and it's available again. So you guys probably remember months ago when you'd go to the store and nothing that you needed or wanted was there. You can now stock up on frozen vegetables, on bone broth, organic berries. You can buy organic fruit when it's on sale and cut it up and put it in the freezer. If you cook with spices like oregano, thyme, sage, garlic, ginger, and basil, these have natural antiviral properties. And then drinking lots of water is very helpful. Eat foods that are high in antioxidants and flavonoids, healthy fats, and foods high in omega-3 fatty acids. And I listed some of those things here as far as antioxidants and flavonoids go. 5 to 7 servings of vegetables per day. Vegetables like onions, celery, and parsley don't sound very colorful or awesome, but they are very high in flavonoids, and they do help your body to get rid of toxins that it's held on to during the day. 2 to 3 servings of fruits and vegetables, tomatoes, apples, oranges, berries, these colorful brightly red and purple colored fruits are excellent for you. And it's really best for the body to get what it needs from food. In fact, I just listened to a physician give a continuing education talk about supplements for brain health today. And I was so relieved to hear him say the same thing, that if you think that you can get all of that goodness that I just talked about in those certain foods in a capsule, you're actually wrong. So eating those things is way better for you. Your body likes them better. Don't take supplements without consulting a healthcare provider who is knowledgeable about herbs and supplements and conventional medicine and medications. The evidence for supplements being used to protect you from COVID-19 is mostly theoretical, and it's based on cellular data. So there's much better evidence for hand washing, physical distancing, covering coughs and sneezes than spending $80 a month on supplements. The goals of supplementation for COVID-19, the goals of supplementation for COVID-19 are to block viral entry, inhibit viral replication, improve innate immunity, balance immune responses, and prevent inflammation from going awry. But the good news is that some of these things you actually may already be taking, the things for which there's some theoretical evidence. And those are things like turmeric, zinc, quercetin, and melatonin. Depending on your medical history, these things and vitamin C might actually offer you some protection. You have to be careful with all of these supplements if you're taking blood thinners. You need to be careful with zinc, because if you take too much zinc, you can become deficient in copper. So again, they're things that you don't want to go blindly into the store to buy without knowing some of the backstory about these things. Now you can add turmeric, the spice, the powder, to anything. You can add it to soups, to salads, to sauces, to smoothies, and it doesn't necessarily taste like anything as long as you keep it to a minimum, or I should say don't overdo it. Don't let your 3-year-old son make your smoothie. So I'll move on to Melissa. You go ahead. I'll scoot your slides forward, and you just tell me when I need to go to the next slide.
Okay, great. Thank you. So we're just going to look at just some basic ways that you can keep exercising. If you aren't ready to go back to the gym, just some things that you can do and why you want to do them. So we're going to just spend a little bit on the benefits of exercise. It kind of will piggyback a little bit on what Megan was talking about. How to work out from home. So I'll have a little handout for you and an actual workout for you. And then how to return to the gym if you are really thinking about it. So, all right. So exercise is medicine. So this kind of is a piggyback on, again, what Megan is saying. It's not just keeping your body healthy with food, but with exercise. So exercise and physical activity both help promote your overall health. So what's the difference? So exercise is planned activity using your large muscle groups for a planned period of time to achieve a goal. You want to run a 5K, you want to be able to walk a mile, you want to be able to bench press 80 pounds, whatever. So you exercise to reach that goal. Physical activity is any physical activity, walking your dog, mowing your grass, washing your car, that kind of thing. So both have benefits. So they both play a role in maintaining a healthy immune system, but they also help reduce other risk factors that can exacerbate COVID-19, such as obesity, heart disease, lung disease, high blood pressure, and type 2 diabetes, like we just saw. So one of the things to keep in mind that with this COVID-19 is only 6%, and again, this came from CDC as well, only 6% of the people who died actually died from COVID alone. So having some of these exacerbating conditions puts you at higher risk as well as being older. So we want to try to mitigate some of these exacerbating conditions. So the CDC listed influenza, pneumonia, respiratory failure as one of the main comorbidities that they saw with COVID. Then hypertension, diabetes, vascular and unspecified dementia, cardiac arrest, heart failure, and renal failure. Those were all the most common complications. So if you're susceptible to any of those, then you obviously want to take more precautions, but get out there and start doing a little bit of exercise because it can positively affect those conditions. So what are you going to do, right? Everybody tells you exercise, exercise. I love it, but nobody really tells you like what is exercise and how can you do it. So you can work out from home. There's more and more options every day for working out at home. I worked out at home long before COVID started, so it was an easy transition for me. But there's even more resources out there now than there was. So to do some cardiovascular exercise, so that's commonly what we maybe have referred to in the past as aerobic exercise, just getting your heart rate up, getting your breathing rate up, and walking is obviously the easiest. If you aren't comfortable going outside, walk up and down the hallway, walk up and down your stairs if you have them. There's ways that you can do it. You just kind of have to be creative sometimes. It is hot still, even though the weather's starting to change a little bit, it's still so hot. So carry some water with you, and time it. Don't try not to go at noon. You can go earlier in the morning, last thing in the day, to keep yourself safe from that, because obviously that exercise could have a risk too if you're not being careful. There's a lot of online sites out there, like I was saying. So Peloton is one. You guys maybe have seen commercials for Peloton. It is not just a bike. You can download the app. For a while, the app was free I don't know if it still is free for 90 days, but if it's only $12.99 a month, and it has everything. You don't need a bike, you don't need a treadmill, you don't need weights. You can have those things, and you say, oh, I have these dumbbells, I don't know what to do with them. Download the app. There's classes that you can take. There's really good coaches, and they'll program you, here's your 4-week program, or here's just a workout for today. You can do yoga, stretching, breathing and meditation, outside walks, outside jogs, walk on a treadmill. There's so many options on that app. So if you're really just getting kind of bored with what am I going to do at home, that's a great place to start. A lot of gyms, like I know the YMCA has put a lot of their classes online. So they'll have a class and they'll record it, and you can go to their website, and there's just a big list of recorded classes, and you can take a strength training class, you can take a stretching class, just whenever you want. There's so many other options out there on YouTube. Just go to YouTube. It may take a few times to figure out, what you like. But if you're into yoga with Adrienne is really popular one, because she has all levels, start at the very, very beginning to more advanced. So there's lots of options out there if you're just not comfortable going back to the gym yet. So if you're going to do some exercise, how much should you do to get this health benefit? That's the whole point, right? We don't just want to be, exercise just because. We want to get some benefit from it. So whether it's, the mental benefit or the physical benefit, there is a minimum, there's a threshold that you have to get. So you want to get 150 minutes a week. And so that's normally, we break that down to 30 minutes for 5 days a week. That's 150 minutes. So, and then how hard should it be? You want to be working hard enough that you can still carry on a conversation, but you could not sing. So if you're, flute along and you can sing, up it up a little bit. If you're getting to the point where you can't keep the conversation, you're probably just about right. So you can do some cardiovascular training, and then of course resistance training. So that's going to be anything that's going to make your muscles stronger. So it's very important as with cardiovascular activity, to do them both. If you like one, you don't like the other one, pick the one you like and or mix them both, but make sure you try to get a little bit of both, because resistance training also improves your blood pressure. It improves your blood sugar, so if you are at risk for type 2 diabetes, and it improves your lipid profiles. But you don't necessarily need weights. I like this. You guys may have seen this right at the beginning of the pandemic, where this man's gym closed. I forget where he lives. And so he got a bunch of logs and built his own. And he had a whole little gym outside with the trees that he had cut down and built into weights that he could use. So, but you don't really need any weights, and you don't need a lot of space. We have body weight, so we can carry that around. We carry it around all day, so let's use it. You can use it to do any kind of body weight exercises. I just put in a handful for you, some lunges, some squats, some push-ups, some dips. You're like me and you're like, oh, push-ups the worst. I hate push-ups. You don't have to get down on the ground and do them on the ground. Do them on the wall, do them on your countertop, do them on your stairs, make them a little bit easier for you, so you still get the benefit from it. And you're probably more likely to be doing it correctly. If you're struggling to get down on the floor, then just, do it on an incline. And how many should you do? Because obviously, again, you want to hit that threshold. The minimum is one set of 8 reps. That's the minimum. Okay, so hit that. Everybody can do that. One set of 8, 8 to 12, but try to aim for 3 sets, 8 to 12 repetitions. Rest as much time as you need in between. So a squat, sometimes when you say squat, people are like, oh, I'd never squat. They think of big bodybuilders with weight on their back or holding something really heavy in front of you. But we get in and out of a chair every day. We get in and out of our cars, whatever we're doing. So that's a squat. So here's the perfect picture. She holds a dumbbell. If you don't have a dumbbell, you got your body weight. I do like to keep my hands in front like this, because it helps keep my upper body up and helps kind of counterbalance that backwards move. I like this one specifically because there's a bench behind you. Put a chair or something behind you. You can touch the chair, or if you lose your balance, you're going to fall into the chair. So that's always a good thing to use. And then lunges is just basically taking a big step and bringing your body, it's a genuflect. That's what I tell people, right? That's a lunge, right? So I can say that to this crowd because everybody knows what a genuflect is. So that's what it is. You can do the repetitions all on the same side. You can do them walking and alternate if you want, just a big step and down like an elevator, not down like an escalator. Your weight should be really on your front heel in this picture. So not the back leg. The weight goes to the front leg and then you just go straight down.
And I guess so depending on who's in front of you or behind you, you'd either be doing a forward lunge or a reverse lunge.
That's
as
true.
A genuflect.
Exactly. Yep, good one. So yeah, you can pick your favorite knee, and that's right. And then for the push-ups, like I was saying, you can use a bench. You can use a bench, you can use a chair, countertops, whatever you have. You don't have to be on the floor. You can also use this instead of having the weight on your feet. You can keep your weight to your knee. So you just bend your knee. Some people have knee problems, so it's easier just to do them. Do them into the wall. And then a dip is the same kind of thing. So you're just scooting to the edge of your chair, and you're just working the backs of your arms with this and your upper back a little bit. And I like the dip because you can use your heels. You can see in the picture, how the closer your heels are to the chair, the easier it is. And you can use your lower body to help lift your upper body. So you don't have to worry about it being all arms if your arms aren't very strong yet.
So to finish up our presentation, Melissa created an at-home workout for you guys, and this is actually easily accessible. We will send you a link to this workout. It's about 30 minutes long, and all of it uses your own body weight. So it's an excellent way to start back to exercise in a safe way if you are not comfortable going to the gym just yet. So you'll get that link in a different platform, probably right below where you're watching this on Facebook, and also in an email. How to return to the gym. So this is the question that people ask us the most. First of all, you really want to talk to your healthcare provider and find out what your risk category is for COVID-19. And then once your doctor may say, it might be safer for you to stay at home, or if you exercise the right precautions, you can go. Then you want to talk to your workout facility. You want to find out what policies they're using, whether or not they have a mask policy, what their disinfecting policy is. Maybe they've decreased the percentage of people that they have in the gym at one time. And then just to be safe, you want to ask people who are actually going to your gym what it's like during the time frame that you want to go there. Because of course the gyms want you back in, right? So you want to talk to the consumers and see what they're really seeing. Some gyms do have a senior hour, so you may inquire about that if you're in that age group as well. I think the best news is that on September 2nd, there was a study published that showed that from May through August, over 50 million gym check-ins showed only 0.0023% of people as being COVID positive. So it's really become, as this quote says, abundantly clear that safety measures from gyms, sports clubs, and boutique fitness centers are effective and curbing potential spread of COVID-19. Again, talk to the gym, be sure that they are exercising appropriate measures. And now that in Florida, things are opening up a little bit faster now, you just want to take that into account, like where has everybody else been to? Here's our contact information. Again, it will be available to you at any time. And we look forward to seeing you on our next series, which will be about depression, anxiety, and substance abuse during the pandemic. Thanks so much. Have a great night.